The last technique we'll go over is the huff cough, okay? Again, coughing and the ability to do that is very important for mobilizing secretions. Remember, we have our mucociliary elevator. Our mucus, our goblet cells produce mucus, which trap infiltrates or kinds of nasty, gnarly stuff that may be sitting in your lungs, and they, the ciliary or ciliate your lungs help kind of move them up into the bronchial tree to help you cough them out when they stimulate the carina. In patients with COPD, post-operatively, or anyone on narcotics or opiates, that cough mechanism may be altered, or in patients with neuromuscular disease as well. Coughing, of course, is a high pressure, and again, someone with an open wound on their chest or on their abdomen, that may be quite painful and maybe not as indicated. There's techniques we can use as far as bracing, but huff coughing can be effective as well, right? So typically you do a huff cough after someone does active cycle breathing. So we'll have Briana do a active cycle breathing, because if you just do a huff cough by itself, it doesn't really do much for you. Okay, so we'll have you do active cycle breathing, and then after she completes her third cycle, she'll of course breathe in and then huff out. Okay, the idea is you're kind of forcing air through an open mouth, so you're not bearing down like you would when you cough. You're like you're taking a deep yawn. Depending on how forceful you want to go, you can have the patient breathe in and kind of get their arms into it too. All right. It all depends on what they've got going on. Again, someone with a rib fracture moving their arms up and coming down forcibly may not be as well tolerated. Okay, so we'll try this here. So we'll do our active cycle breathing. Very good. So typically you can, we indicate 1 to 2 coughs. 3 is fine. There's no real rhyme or reason. As long as you do at least 2, they help kind of mobilize secretions. And with that, the patient may, get some stuff out, so you can get, a towel or something there to capture the sputum. So that was the huff cough.